If you have problems with your shoulder, impingement syndrome, a calcified shoulder, arthrosis, pain in general, anything that can go wrong with your shoulder, well then get ready. I'm Liebscher Bracht and I'm going to explain why we think these problems occur and show you how to deal with them. To make it easier for you to understand, I'll just explain the shoulder to you. You could see the humerus, the upper arm bone. Here, the head of that bone sits in this little socket here. You could hardly see it. So you have a big head and a rather small socket it moves around in. And that gives you a wide range of motion, at least in theory. But that also means that the surrounding muscles are very important to stabilize this guided motion in the joint so that everything fits snugly the way it's supposed to. And since there's so many muscles, the rotator cuff, smaller, bigger, and very big muscles. And this is why a lot of people, therapists and doctors, think it's difficult to treat the shoulder on account of that large number of muscles. And it's hard to tell which muscle is responsible for which function, which pain even, or which form of damage. Just like with any other pain, shoulder pain is on the rise. 70% of our population have massive problems, at least once in their lives. And what the concrete causes are, if you go to a doctor or physiotherapist for an explanation, no one seems to know or has any idea why. And you often hear things like, well, you were born with it, it's a certain weakness or inflammation. But we know the concrete cause, as you can see in a minute. Well, the common approach to shoulder pain has led to 100,000 artificial shoulder implants in Germany alone. Now, if you ask me, what's the cause of these problems? The pain, the arthrosis, all that damage in your shoulder, I'll tell you that in most cases, the root cause lies in not moving our shoulders in all the angles that are possible. We often have our arms in front of our body, rarely up or even less often in the back, and all this limits the angles we use dramatically. Looking at the entire body, I always say, of the 100% flexibility we have in our body, we use at best 5 to 10%. And with the shoulder, and I did the math, as you know, I used to be a mechanical engineer, and regarding the shoulder joint, we use it less than 3%. You're probably stunned about this low number, but I can give you a simple explanation. We use our arms almost exclusively in the front. But the moment we move up and back, here and here, when we're here rotating inwards, or when we're here rotating outwards, as you can imagine, we add a large number of angles we almost never ever use. And therefore, this is a massive underuse of angles. And this leads to two situations of shortened muscles. Here in this area in the front, the biceps, the pectoral muscle, all that is shortened. And if you're always in this position and the tensions around the joint increase to a point that the head of the bone is gradually pulled upwards, there's normally some clearance to the acromion, that's the name for this bone, but if everything becomes tighter here, it's getting pulled up, and that pinches on the supraspinatus tendon, it pushes on the bursa, it gets inflamed, plus something else happens. Due to this lack of movement, you have over-acidity in the tissues here, and that pushes the water out of the fascia because it loses its ability to retain water. That means everything is drying up in there. Calcium forms. Bits of calcium stick in the tissue. That's why you have a calcified shoulder and, of course, pain, so-called alarm signal pain. A pain signal that your body sends to protect the structure. And if that's something you'd like to understand, click up here for a video that will explain. And this alarm pain warns you about excessive tensions. Always remember, excessive tension is the root cause, and that also leads to arthrosis. Too much pressure in your movements means more wear and tear. And the limited movements lead to the cartilage not being pressed enough, so they become undernourished. And this double effect doesn't give your joints a chance, and that's why arthrosis in the shoulder is so common. Even more so in the knee and hip joints compared to the shoulder. And because the upper arm bone is pulled upward, everything is pinched up here. Let me show you so you can understand. Here you find this supraspinatus that starts here, runs underneath to end up in your arm. And if this muscle is pinched upon because everything gets tighter here, this tendon of this muscle starts to splice up, is increasingly worn out and can even come off, and that leads to pain in the bursa and even bursitis. Please remember, pain in this area is always a repair job being done. That's not bad, it's something good. Whenever there's an inflammation, something is being repaired. And the calcified deposits can become really bad. Alex, a colleague of mine, told me this story. He had a patient, a tennis player, and she had a block of calcium around the supraspinatus tendon. Imagine what your body is doing here. It wants to get rid of its calcium surplus, and it deposits this calcium wherever there's room, where movement happens. And where the tendon doesn't move, a tunnel is created, and around it a solid block of calcium forms. So that's a great example, because after releasing the tension using our osteopressure therapy, this lady got rid of her pain completely in spite of this gigantic block of calcium in there. No pain, full range of motion. The calcium seems to deposit in a way that still allows movement, provided the muscles play their part again because the tensions have been normalized. And there's another effect that you usually do not associate with shoulder pain, and that is directly connected. The numbness in your forearms, your fingers, cold hands, and so on. Always remember our model. The tendons, the vessels, and the nerves always run through tissue. And the moment this tissue is subject to excessive pressure, the blood vessels, the lymphic vessels, the nerves. These are small, flexible tubes or hoses, to give you an image. And the moment you pinch on those hoses, it's just like with a garden hose. When you water your plants and you step on the hose, the water is cut off. It's the same in your body. People don't pay enough attention to this. So remember, if you know people whose fingers go numb during the night, he or she definitely needs to relax the shoulder neck area, and the problem will vanish into thin air as if it has never occurred. But what do doctors prescribe in most cases? Well, painkillers. But please, I say it again and again, what does this solve? Not the problem, to be sure. Maybe you can alleviate the pain. Sometimes not even that. But if you can alleviate the pain, then this is bad, since the alarm pain that your body sends to protect against damage will be switched off. You can't switch off an alarm that's supposed to warn you. Always remember my example of driving in your car on the highway and your oil lamp lights up, and you just cover it up or pull the wire and then drive on. No reasonable person would do that because your engine would seize up. So what would a driver do? You pull to the curb or stop at the next gas station and fill up on oil so everything can go back to normal. And this is exactly how we should treat our body. We should look at the situation like this. Why did I get this warning signal? Okay, this means excessive tension, so I simply have to dial down the tension. Painkillers don't change anything about this underlying situation. It helps you get through the pain, but you have to take ever higher doses, especially with chronic pain. And that's not a solution. It's okay for a short time, but definitely not longer. And remember, a painkiller has clear and sometimes severe side effects no one wants. So please read the inserts and instructions on the bottles carefully. If people did that, a lot of them would stop taking so many pills. And then the impingement surgery enters the picture. It's the most common operation on the shoulder as the last resort. What happens there? Let's take a look. The upper arm bone, due to excessive tension in the muscle and fascia, has gradually been pulled upwards, has a pinching effect up here, changes the bone surface, osteophytes stick out a bit, so changes are happening in response to excessive pressure. What does surgery here involve? If it's only about removing the osteophytes, I'd say That's kind of okay, even though it's not really necessary. We've had so many patients where you could clearly see the changes. But the moment we normalized the tension, the pain disappeared, and these changes were of no consequence. It's mostly an aesthetic problem. But sometimes things come to a point where bone is surgically cut from the acromion. They shave off bone, and the idea is that gives you more space. But please, whatever it is that pulls the upper arm bone upwards will continue to do so. And that means if you take off bone here, then there's even more space for the bone to be pulled upwards into. And you have a tight situation again. This is absolutely not a solution because it does not bring any positive change since the root cause has not been removed. The reason why the pain goes away after surgery or is diminished, at least for some time, is anesthesia. The anesthesia relaxes and releases the tension, which is the real culprit for this pain. That tension is lower, and that lasts for a couple of weeks or months, and then it starts again. And an artificial shoulder joint doesn't really solve the problem. Sure, it might be better after surgery due to the anesthesia again. Now, I claim many operations on the shoulder bring down the pain, minimize it, or switch it off completely for the time being because of the anesthesia or the surgery itself. Because if you cut here, you may damage muscles, tissue, and that releases tension too, which again is the root cause. And here again, my big ask, share this video with everybody you know. This video should be shown at every school. It should be part of the curriculum. Then people would know about their bodies and not walk into traps. It would never come to that. And that's why you should share this knowledge and participate in our vision to make the world free of pain. Help us with this. Be part of it. And now, you probably can't wait to learn what it is you have to do. You do what we always do, stretch. But it's important to understand that our stretching exercises, our special exercises, are not only good stretching, they also build strength. They strengthen in a way that is contrary to what you may have heard. They strengthen in a way that doesn't increase tension or lead to shortened muscles, but make the muscles flexible at the same time. And that's what your body needs, what your shoulder needs. And if you do that for your shoulder, this negative feedback loop that takes you deeper into the pain is stopped. And you start a positive feedback loop because by stretching, you increase your flexibility and above all, your pain will go away. You increase your movement, and this boosts the metabolism in this region. And you flex and relax areas that before have been neglected and almost dead. That means life returns, tensions go down, normalize, and your shoulder is fully functional again. Any damage will be repaired, arthrosis too. Not everybody knows that, but that doesn't make it less true. Other than the exercises, you can actively shape your day. Never avoid movements that ask you to raise your arms. So, there's something crazy that I saw a few years ago. Maybe that isn't done anymore. But there was a time when kitchen manufacturers started to deliver small step ladders with their kitchens. So you got a step ladder thrown into the deal. Why? Because many people can't manage to put a plate up there into a cabinet. So they had to walk up the ladder to put it in a cabinet like this. It can get to such extremes. So think for a moment before you put something on a shelf like this, and then go and try it this way. Or even more, not like this, with your arm rotated. This could become a habit. What should be on your mind is moving your arm in as many directions as possible and as often as possible. That's a great supplement to our exercises and helps you on your way towards being pain-free and flexible. And here's an important test for you. You lie down on your back, your arms are resting left and right, and check if your shoulders can touch the floor. Many people can't do that anymore. Their shoulders are slouched inward, so they can't move back because everything here in the front is shortened. And that's great for showing you the goal you want to achieve. That motivates you to do the relevant exercises. To sum it up, you solve the problems by removing the tensions and stretch your muscles and so increase the number of angles you move at. Have fun and see you soon.